All right, so we want to continue this exploration of rotation in sports. When you look at athletic movement, you have to be able to separate what your shoulders are doing and what your hips doing. If somebody's going to hit a ball, their hips turn first, shoulders stay behind. That's what allows us to create some torque and force to kind of whip through and create power. The same thing happens when we walk, the same thing happens when we run. So we need to be able to assess our ability to separate what's happening at our shoulders from our hips. One of the easiest ways to do that is rolling. So we're going to have Clint go ahead and get on the floor and do a little bit of a rolling drill, and we'll see what it looks like. So what Clint's going to try to do is he's going to try to rotate through his upper body, leaving his hips behind. And he's trying to create as much separation as he can through the shoulders and the hips. As he comes back around, you're going to see the shoulders turn. We see some thoracic rotation. He's fighting a little restriction. That hip's lifting a little early as he comes back. You'll see the same thing coming from front to back. His hip flexor in the front wants to kick in. If you saw that blog post, we talked about hip flexor, spinal extensor activity, and how it limits rotation. So as he's going through this rolling motion, you're seeing some of those patterns. Let's have it go one the other way too. You can see him kicking in that heel, having difficulty separating what's happening with the upper body and the lower. So then from there, we got to figure out what's going on. Is it a stiffness problem? Is it a muscle guarding? Is it a normal injury? What's happening that he's having difficulty separating shoulders from hips? If we can correct that, improve that ability to rotate, we're gonna give him some athletic power and some performance in sports.